Welcome to the Nanticoke Lenni Lenape Tribal Nations Native Power Hour, a public humanities broadcast. I'm Linda Little Bright Star Jackson, your host, and this is the native voice of Lenapehoking and the Nanticoke Lenni Lenape Tribal Nation. I hope that you enjoy this episode. The Nanticoke Lenni Lenape Tribal Nation and the Native Power Hour is happy to present Sherry Caputo. Sherry is here with us today, and she's going to tell us about what she's presented for us. Welcome, Sherry, to the Native Power Hour. We're so pleased to have you here today.
Thank you for having me. It's good to be here. So, as Linda said, my name is Sherry Munson Caputo. My tribal name is Strong Sun Spirit. And today I put together an educational about diabetes and also if you happen to have diabetes and you also get COVID. Type 2 diabetes is unfortunately affects 90 to 95% of people that are diagnosed with diabetes, and it's high incidences that occur in the Native American population. So I hope you enjoy the video and lecture.
Hi, my name is Sherry Caputo, and I'm the Nanticoke Lenni Lenape Tribal COVID Coordinator. I'm also a registered nurse in New Jersey, Pennsylvania, and Delaware. I wanted to take some time out today to talk to you about diabetes, and I'm also going to include just a little bit about COVID-19 and how it can impact you if you do have diabetes. I have a video from the CDC that talks a little bit about diabetes, especially type 2 diabetes, which is the most prevalent form of diabetes. So I'm just going to share this video with you.
At the turn of the last century, Native people lived off the land, hunting, fishing, gathering, and farming. As times changed, our way of life changed. Many of us were not as physically active as we used to be. Our land was not used to grow, gather, and hunt traditional foods as in the past. The changes to our culture have had a devastating impact. Our tribal and reservation communities have suffered a dramatic rise in illness from a dangerous disease, type 2 diabetes. Today, Native American communities are on the move. Traditional foods and physical activity are a way to talk about health, our health, based on our traditions.
Let her up now. Sticks up, sticks up. Yeah.
Oh, hey, it's Wes.
Let's see.
We women are running them into the ground, Wes. They need your skills out there.
I could use the exercise, but no.
Don't worry, Studi. We made the poll short. I bet you score quick today.
Okay. All right, you're on.
Looks like a pretty young bunch, Wes.
Yeah, well, that'll be their downfall. Good. Hey! The old man still got it, Blossom. You're in trouble now.
We have wonderful food for everybody.
Looks healthy. It looks like it might taste good, too.
We've prepared some of our traditional food to honor what you plan to share with us today.
And I am honored to have been invited to share your table, share your story for all the nations to hear. A story about how a return to traditional foods, healthy traditional foods, and an active lifestyle can help prevent obesity and type 2 diabetes or control them.
Everybody knows somebody who has diabetes, Wes.
Listen to our elders. They can tell a story of a time, not 60 years ago, when there was no word for diabetes in our language. The illness was so rare. We all know that our way of life was changed throughout history in ways that created the traumas and illnesses that we suffer from today. Since the 1950s, Native families have relied more and more on processed foods, high in sugar and fat and low in fiber.
We teach the children to call them sometimes foods. You can only have them sometimes.
Yes, but this all looks healthy.
It's our own homegrown vegetables and fruits, and as you know, it tastes good too.
Oh, yeah.
I hope you all enjoy.
Mr. Studi, I'm Jimmy. In school, my teacher says that we should eat healthy foods, drink water, and be active.
Well, you heard what we all need to hear. Yeah. Make wise choices. Follow your traditions. And I know from listening to your words that we have the power to prevent type 2 diabetes and obesity in our communities. Ah, wonderful. We have salmon, corn, squash, beans.
The Three Sisters.
Yeah.
We have tepary beans from the Southwest Sisters as well. And really, there's food here from all four directions. And lots of different kinds of food from many different tribes from all over the country, huh?
But don't forget the kanache.
You bet. And from our brothers and sisters in the plains.
We have the traditional buffalo, some deer. Nice. I like them both. They're good for you, too.
You know, Wes, with a good, healthy diet, you may be able to help prevent diabetes.
Well, we all know that this disease is a growing problem, not only across our country, but around the world. In native nations, our young people are at a greater risk for type 2 diabetes than young people in general.
That's a problem.
Yes, many things came together to create this problem. Thousands of years ago, native peoples prevented this disease by harvesting and eating traditional foods. So we know how to prevent obesity and type 2 diabetes. We need our elders, the voices of our elders, along with our young people, to speak out.
I often tell people to exercise and eat healthy.
Well, we should eat healthy then, before my story and our food gets colder.
I'd like to have our honored guest give our blessing. Wes?
I want to honor your table, our friends, and our tradition. Provider who has given all, from the appearing way to the east, the cold way to the north, and the disappearing way to the west, and the warm way to the south. You have spoken to us, and we have spoken to you.
Better get some of this venison. I haven't gotten any of this.
Everybody have what they're looking for? Anybody?
Really? The salmon? Oh, yeah, I might need some of that.
Have you tried
A little bit of green. Health is our life in balance. Native people are on the move to bring back traditional healthy foods and physical activity to help prevent type 2 diabetes. For our health and the health of our future generations, follow our rich traditions. Eat healthy, be active, make wise choices. I know we have the power. Our people and cultures hold the answers. We will return to our life in balance.
So what is diabetes exactly? Maybe you've been diagnosed with diabetes, you've had it for a long time, maybe someone you know has diabetes, but do you really know what it is? I've heard some people say, like they were told their sugars were high, their blood sugar, but sometimes they're not necessarily sure anything outside of that, what that means or what is blood sugar and exactly. So basically when cells in your muscle, fat in your liver, they become resistant to insulin. Sometimes the blood glucose, so glucose is another term for blood sugar. Glucose is a sugar that is found in your bloodstream. Sometimes the glucose and the insulin don't interact the way they're supposed to. The pancreas is unable sometimes to produce enough insulin. So insulin is something that's naturally made in your body. So you can also take insulin injections. So insulin injections, that actually is giving you a synthetic replacement for the insulin that your pancreas is no longer able to make or not able to make enough of. So this helps regulate your blood sugar. I have another little video that I just kind of want to show to explain a little bit about how your body uses your blood glucose.
Diabetes is a growing problem in both the developed and developing world and is associated with long-term healthcare problems. There are two forms of diabetes, type 1 and type 2, but both are associated with the inability of the body to effectively control blood glucose levels. This video will aim to show how ineffective regulation of blood glucose occurs and go through some of the consequences for our health when it does. In order to understand how glucose control goes wrong, we must first understand how healthy regulation is conducted. This means understanding the relationship between glucose and the hormone insulin. Glucose is obtained from our diets. It's an important energy source for our cells. However, glucose must first be able to enter a cell before it can be used. And to successfully pass through the cell membrane, it needs help from the hormone insulin. Insulin is secreted into the blood by specialist cells in the pancreas. It can be thought of as a bit like a key, unlocking the cell and allowing the glucose to enter. Insulin interacts with the membrane of the cell, making it permeable to glucose. Once the glucose is inside, it can be broken down and used for energy. Insulin therefore controls the uptake of glucose from the blood, ensuring that there's a steady fuel supply for the cell and that the glucose is not used up too quickly. When blood sugar levels are high, some of the glucose is stored away by the body for later use. It's taken into the liver and skeletal muscles, where it's converted into glycogen, a stored form of glucose. It's also absorbed into fat cells. Insulin is again the hormone that regulates this process. As with other cells, the liver, muscle and fat cells cannot absorb glucose without insulin first interacting with their membranes. Insulin therefore controls how much glucose is stored away. So let's take a look at insulin and glucose in action. If we eat a meal, our blood sugar levels will rise. Specialist cells within the pancreas are sensitive to glucose levels and will secrete more insulin into the bloodstream in response. The increased insulin levels will lead to greater interaction with cell membranes, promoting greater uptake of glucose into the cells. The high insulin levels also promote increased storage of glucose in the liver, muscle and fat cells. Glucose levels in the blood will begin to reduce as the sugar is taken into the body's cells. The pancreas, detecting this change, will also reduce the rate of insulin secretion, ensuring the supply of glucose is not used up too quickly. The hormone glucagon, also secreted by the pancreas, is responsible for the conversion of stored glycogen in the liver and muscle back into glucose. High insulin levels suppress the release of glucagon into the blood, preventing the release of the stored sugars. However, if glucose levels become low, for example when a patient is fasted, then insulin levels will also drop. With insulin levels reduced, the release of glucagon is no longer suppressed. It can now interact with the liver, stimulating the release of glucose and restoring blood sugar levels to within a safe range. This continuous cycle helps maintain blood sugar levels within safe parameters. Blood sugars are not allowed to become too low, depriving the body of its fuel supply, or too high, the consequences of which we will look at later in the video. It's also worth noting that while insulin levels will reduce in response to low blood sugar levels, in a healthy person there will always be some insulin present in the blood. If insulin levels were to reduce to zero, then our cells would not be able to take in glucose at all and would cease to function. We need insulin to live.
So as we've seen in the video, what does glucose do in your body? So glucose is actually the main source of energy for your cells. So your body is made up of trillions and trillions of these individual cells. Some of them work together to function as one, like in your liver or your heart. And some of them, they operate separately from each other. So like your heart cells are different than your skin cells, which operate different than your liver cells. But each one of these cells require glucose to come into them to provide them with the energy they need to function. Without that glucose and not having energy, the cells will die off. So as you can see, it's really important to get glucose into those cells. Glucose comes from two different sources, so it can come from your food and your liver. Again, glucose is just sugar. It's a form of sugar that's liquefied into your bloodstream, and it's how your body uses it. It needs insulin to get into the cell, as you've seen, so it can be stored into the liver. Your liver also makes glucose. Your liver breaks down stored glycogen into glucose, because again, your body really wants that glucose constantly coming around because it's important. So we've talked a lot about insulin. So insulin is actually a hormone that is created and made in your pancreas. It regulates how the blood uses the insulin, the sugar. Insulin regulates the blood sugar. So as you saw in the video, your sugar levels rise in your bloodstream. That tells the pancreas it needs to send some insulin so that you can now take that from the bloodstream, put it into a cell. Your cells can use it for their energy and to keep their processes going. Your brain uses a lot of glucose in order to function and keep you mentally alert and processing things. So sometimes when you get really hungry, you realize like you're not thinking as clearly as you could. You sit and have a snack or you eat something, and you feel a lot better, and you're able to maybe get through a project or something like that. Insulin helps sugar enter your cells for use as energy, and it also regulates how much sugar to insulin is in the blood at any given time. So pre-diabetes. So sometimes people get diagnosed as pre-diabetes. So basically what that is when you go to the doctor and you have your blood sugar checked. It can be a random or it can be a fasting blood sugar. But the levels are higher than they normally expect. So it's not high enough that you would be diagnosed with diabetes. However, it can still cause and lead to heart disease, stroke, and you're on your way to possibly getting type 2 diabetes. The good news is it's reversible. So if you've been diagnosed with prediabetes, you can have some lifestyle changes that can help reduce your chances of going into type 2 diabetes. Like we saw in the original video, a healthy diet, activity, watching what you eat. These are all things that can help limit it going into type 2 diabetes. Watching your weight. So, exercise. So exercise doesn't have to be going to the gym and running a mile and all that other stuff. It can literally be broken down into, say you can only do maybe 10 minutes of walking a day, or maybe go 10 minutes in the morning and then 10 minutes in the afternoon around lunchtime, and then maybe do 10 more, around dinner time. You've gotten 30 minutes of exercise in within a day, just breaking it down in 10-minute intervals. Again, choose whole foods, fresh fruits. When you go into the grocery store, so I challenge you, next time you go to the grocery store, take a look and see how it's laid out. So all of your fresh, healthy foods are on the perimeter of the grocery store. So generally you walk into your grocery store, usually hit the produce section. That's where all your fresh fruits, your fresh vegetables are. You usually go around and you have either your dairy section or it's your meat sections. And then you go into your frozen foods. Frozen foods are better choices for you, frozen vegetables, frozen fruits, than canned items because they're lower in sodium and they actually have more of their vitamin content preserved in them the way they're frozen. When you get into the middle aisles of the grocery store, that's where you're going to start finding all of your processed, your refined sugars, your high fat, high carb, high sodium, canned. That's where a lot of our junk foods live, in those middle sections. So when you go to the grocery store again, kind of just take a look at how your grocery store is laid out and see if you don't find that to be true. When you just look around the perimeter of the grocery store, all of your healthier food options are on the outside. So type 1 diabetes, we're only going to talk about that for a minute. So type 1 diabetes really only affects 5 to 10% of all people that are diagnosed as a diabetic. It's actually an autoimmune condition, which basically prevents the pancreas from making insulin. It destroys the beta cells within the pancreas, so that literally leaves you with almost very little or to no insulin at all. So again, without the insulin, you can have normal blood sugars available, but your body can't get it into the cells where it's needed. And again, we need that blood sugar and glucose into the cells in order for them to function normally or they die. So that's why those people are insulin dependent. It's very important that they get their insulin because their cells have no way to get the needed energy. No matter how much they eat or what they do, they're not able to get that nutrient into that cell where they really need it. But because it's such a small percentage of all diabetics diagnosed, we're not really going to focus on that. We're going to focus on the more common type, which is type 2. So type 2 diabetes. So this affects 90 to 95% of people in the population. It used to be called adult onset diabetes, but they've stopped calling it that now because more and more children and adolescents who didn't used to really get type 2 diabetes, they would usually be the type 1s. Now because of less activity, they're becoming more overweight. Our food choices sometimes aren't the best. So children as a whole have become less active, video games, modern technologies, car rides, things like that versus walking. So their weight's starting to increase, their risk factors are starting to increase. So we're also seeing a lot more of them diagnosed with type 2 diabetes at a younger and younger age. So type 2 diabetes occurs when your body does not regulate or use the blood sugar, which is also glucose, as fuel or energy for the cell. It can be a long-term or chronic condition. When blood sugar levels are high over time, it can lead to circulatory problems, which is blood flow, nervous problems, nervous system problems, or immune system problems. So examples of that. So let's talk about circulatory blood flow. So you can get wounds especially on your legs or your feet that just don't heal properly. Blood sugars that aren't regulated within normal ranges makes them harder for those wounds to actually heal. It also, because your blood is actually sweet, it's a sugar, there's a higher chance of bacterial infections in those wounds. And unfortunately, you see a lot of diabetics end up with amputations of their toes, their feet, their legs, because they really just aren't getting the blood supply there because of capillary damage. So what does that mean? So everybody knows, like the big veins in their arms and arteries that carry your blood, to and from your heart, and you get your blood test. But within the tissue levels of your body, you have what's called capillaries. These are really fine, almost like hair-like blood vessels. Literally, they're like only one cell thick, so it's not very much. That's where your exchange of waste and oxygens and things like that happen into the tissues of your cells and of your body. So what happens is this high sugar over time, it damages those. So it makes it so that they can't do those things anymore. So now you're not getting the proper blood supply, you're not getting rid of the waste products from the cell, because again, the cell's working. So with everything that's working, it takes in fuel, it gives off some waste, but it has trouble eliminating that as well. So that's where you start getting those circulatory problems that can cause vision problems, because again, you've damaged the capillaries to your eyes, your hands, nervous system. You start getting things called peripheral neuropathy. Some of you might have been diagnosed with that, or it's that numbness in your feet where you can't feel your feet that can start impacting your walking. Sometimes you get numbness in your hands. The problem with your feet, besides that, it makes it harder to walk because you can't find your footing. Some people think it's like, where you almost like feel like you're walking with sand in your shoes. It feels kind of just lumpy. It's not the same feeling throughout. But you can also cut your feet, hurt your feet. That's where proper shoes come into play. Really doing that foot inspection, take a mirror, look at the bottoms of your feet, always wear good shoes. Because if you get any kind of cuts or wounds on your feet, you won't feel them probably. And sometimes if you don't feel them, you don't know that they're there, then they can become infected and a problem before you even realize that it happened. So you really want to take good care of your feet. Just make sure you're seeing a podiatrist regularly. Have them, cut your toenails properly. You really, really do need to take good care of your feet, because you want to keep them with you. Again, amputations do occur frequently, unfortunately, with people with type 2 diabetes because of those wounds that just won't heal and the poor circulation and blood flow that's getting to them. Your immune system, that too gets impacted. Again, the blood sugars, when they're too high, they're not getting into the cells properly. Again, it's like a breeding ground for bacteria and things like that. So it's two problems at work. So type 2 diabetes is sometimes it's your pancreas doesn't produce enough insulin, or it can also just be that your cells respond poorly to the insulin and take in less sugar. It could be both of them. So you have a pancreas that's just not giving you as much insulin as you need to come out. And then you also can have cells that just aren't sensitive anymore. And that comes from just high sugars all the time and not being regulated. You start losing that sensitivity more and more over time. Type 2 diabetes used to be known as adult onset diabetes, like we had talked about. Both type 1 and type 2 can begin now in childhood and adulthood. Type 2 is more common in older adults, but now we're starting to see an increased number of children. There's no cure for type 2 diabetes. However, you can control some health factors that can help lessen that. Some people do control their diabetes through diet and exercise. Sometimes it's not enough, and then you have to take different kinds of medications. But really losing weight, eating a healthy diet with your fresh fruits, fresh vegetables, but even your fruits you need to watch, because again, blood sugars and blood glucose are carbohydrates. So when you talk about foods, you have carbohydrates, you have proteins, and you have fats. So a carbohydrate is anything that's not a meat or protein, eggs, fish, any type of meat, venison, or a fat, butters, mayonnaise, oils, they're fats. So as you can see, just about everything else is carbohydrates. Your breads, your fruits, your vegetables, they're all carbohydrates. They have different levels of impact to your glycemic numbers. So some of them can spike you really high, some of them are low. Summertime, a lot of people like to eat watermelon. Watermelon is very high in sugar, so you want to limit how much watermelon you eat. You want to educate yourself on which fruits are best to eat that aren't quite as sweet as maybe some other ones, and then just use the ones. So it's not like you're never going to eat watermelon, but you want to eat it sparingly, more as a treat once in a while, like the sometimes food. Yes, watermelon's healthy, but because it's high in sugar and you're having problems processing that sugar, you want to stay away from those higher sugar things. So, what are some symptoms of high and low blood sugar? So, sometimes you might have heard a word called hyperglycemia. So, some people were asked before, like, what did they think that meant when the doctor told them they had hyperglycemia? Some people thought, well, it just means like maybe they're hyper, like they can't sit still. But that's not actually what it is. What this word means is hyper, just means it's hyper high. Anything like glycemic is the glucose, so that's like your glycemic level. And anything with EMIA after it stands for blood. So it's literally high blood sugar. So things that can be associated with that are increased thirst, frequent urination, increased hunger, unintended weight loss, and that's a significant weight loss. Like 10 to 20 pounds within a real short amount of time without really trying to. Fatigue, blurred vision, slow healing sores, frequent infections, numbness and tingling in your hands and feet, that's called that peripheral neuropathy, and areas of darkened skin, usually in the armpits and the neck. So equally as dangerous, so if your blood sugars get too high and are uncontrolled, you can actually unfortunately go into a diabetic coma. So it's real important not to let those numbers get too high. And your doctor will give you guidelines on what that is. And then low blood sugar is hypoglycemia. So hypo means low. Again, you've got your gly, which is your glycemic, which is your sugar, and anything with EMIA after it is talking about blood. So this is low blood sugar. These are low levels of sugar that's available in your bloodstream. So things for that is like sweating, shakiness, weakness, hunger, irritability. So you've seen some of the commercials when they talk about diets. It's like, they say you're hangry. It's because you're hungry and your blood sugars are dropping. So you're hungry, you're irritable, you feel weak, you feel shaky, dizzy, headaches, blurred vision, heart palpitations, slurred speech, drowsiness, and confusion. Low blood sugars can be equally as dangerous. When they go too low, if they're not resolved or not rectified, you resolve them by taking some sugar. So if you decide to take something like a juice, something that's what we call a simple sugar, table sugars, a simple sugar, if you eat a fruit juice, something like that, it's going to bring your blood sugar up very quickly, which is what you want. The problem is you're going to need to still eat something, because just as quickly as it brings you up and you feel instantly better, it's going to drop you back down, sometimes even lower than what you were before. It's not a permanent fix to use simple carbohydrates or sugars. They're good for bringing you up, but when I say you need to eat some complex carbohydrates, so what does that mean? So you want to actually eat your whole wheat breads, whole wheat pastas, peanut butter and jelly sandwich, maybe some peanut butter crackers, because you want to eat something with a complex carb. You also want to add that protein in there and a healthy fat, because that's going to help sustain that out. Okay. Another thing too, if you go too low, you can actually have brain damage, because again, your brain really depends on that blood glucose to function. Unfortunately, I have worked with the patients before in the past, where their blood sugar actually dropped at night and they didn't realize it, and they never woke them up, and unfortunately they have now irreversible permanent brain damage. They can respond to simple commands, but really they're not very functioning after that, and their blood sugars dropped down, and probably I think it was into the 40s. So just a note, symptoms of low blood sugar: you want to drink or eat something quickly, which we discussed. Retest your blood sugar in about 15 minutes or so. Make sure that you're eating an actual meal afterwards. If you happen to lose consciousness, another thing that we suggest to patients and their family have a tube of icing, just regular cake icing that comes in a tube. And if someone actually gets really low like that, or they've become unconscious, you want to squirt some of that icing underneath their tongue. Not enough that you're going to fill their mouth full, you're not trying to choke them as they're unconscious, but putting that underneath their tongue, the sugar gets absorbed through the mucous membrane quickly into the bloodstream. Kind of like people with heart conditions take nitroglycerin, they put that under their tongue and it gets absorbed into their bloodstream that way. You're still going to need to call 911 and get them some help and help make sure that they get straightened out, but that will help them to revive a little bit, because it is an emergency situation. Another thing that can occur with sugar that's a life-threatening condition is called hyperglycemic hyperosmolar non-ketotic syndrome. It's a big mouthful of words. So this is basically a life-threatening condition that includes blood sugar readings higher than 600 milligrams per deciliter. That's a lab test. It's more likely if you have an infection, or if you stop taking your medications as prescribed, or if you're taking certain steroids or drugs that can cause frequent urinations. So sometimes patients and people go into the hospital and they're put on insulin, and you'll hear them say, I don't understand why I'm taking this insulin. They're giving me insulin injections. I'm not a diabetic. I don't understand why they're doing this. Chances are that patient's on a steroid, and these steroids can really drive up your blood sugar. So if you are a diabetic, it can have even more of a significant impact. So you want to be mindful when you're taking any kind of steroids to really keep track of your blood sugars. So signs and symptoms of that include a dry mouth, extreme thirst, drowsiness, confusion, dark urine, and seizures. So another condition that is also, you need to seek medical attention right away, is something called ketoacidosis, diabetic ketoacidosis. So this can occur when there's a lack of insulin that results in the body breaking down fat for fuel rather than sugar. So our bodies are remarkable, and they'll want to try to survive. So some of you might have heard of keto diets and things like that. They're based on the same principle. The difference is with a keto diet, people are eating a low carb diet. They're not eliminating all carbs, and their bodies are perfectly capable of utilizing that blood sugar. And remember, your liver is able to produce some sugars, and your insulin works just fine. So it's getting those sugars that your body needs, and it's putting them into your cells. In a diabetic ketoacidosis state, this person has a lack of insulin, and their bodies can't do anything to help them. So it's not like a choice, and it's not like the liver's releasing more and more glucose because it thinks it needs it, and the cells are getting it. Your cells can't get that glucose. So no matter how abundant it is that's available in the bloodstream, they're starving because they can't get any help. So it turns to fat rather than the sugar to try to keep itself going to survive and get energy. This is where you have the significant weight losses very quickly. This is a result of buildup of acids called ketones in the bloodstream. This can trigger the acidosis. So an acidosis is an abnormal balance of the acidity level of your body. Your body is normally, pH balanced, so at about 7. So these numbers would start going down. You're getting more and more acidic. So things that happen like that, certain illnesses can trigger this, pregnancy, trauma, medications. Sometimes, people that were undiagnosed with their diabetes, and, especially if they're really lacking a lot of insulin, sometimes this can occur. This is sometimes their first find out that they actually have had diabetes. So it's usually less severe in type 2 diabetics, but it can be very toxic. It is a medical emergency. Signs and symptoms, this can be nausea, vomiting, abdominal pain, shortness of breath, a fruity smelling breath. That's the ketones being released. And this usually gets treated at the hospital because it is life-threatening. So testing. So usually you'll get what's called an A1C test. This is a blood test that's fasting, which means that you don't eat anything at night. And you wake up in the morning and you go and get your blood test. Usually they want about 12 hours where you haven't eaten or drank anything for them to actually check your blood sugars. So usually this shows an average of what your blood sugars are over the past 2 or 3 months. So this is just a guide. Each lab that you go to will have parameters of what's normal for their lab ranges, and that's listed on your lab results. So anything generally below 5.7% is normal. At 5.7 to 6.4%, that's when you're considered pre-diabetic. So if you see those numbers and you get diagnosed, that's the time to start doing your lifestyle changes. You know, start your exercise, start eating healthy. You know, if you need to lose some weight, you know, work on doing that as well. Usually if you start exercising and eating better, the weight will kind of start coming off. 6.5% or higher on 2 separate tests, and that's the key. They're not just going to do one test and just decide that you have diabetes. They're going to want to check it again maybe in a few months or in a couple weeks and see if you're still running high, if it's like a one-time thing or if it's really just where you're at. And then that's usually when they'll give you a diagnosis of type 2 diabetes. A random blood sugar test, so that can be a lab test. It can also be like with your glucometers. So that can be anytime. So that can be you just ate a meal. It can be, you know, oh, let's just check what your sugar is. You just ate 20 minutes ago. So it's really no fasting involved. It's just, you know, hey, let's check what you are right now. Fasting blood sugar test, just like the A1C, you're not eating anything. Usually overnight, you wake up in the morning and you're testing. Sometimes you'll test before meals. If you're diabetic, that might be your order if you're testing. So it might tell you to test before each meal. And then you might have medication that you're taking depending on what that test says, if you're taking some kind of injections. If you're taking pills, you probably don't test as much, but you should have an idea of what your blood sugar is running, because again, you really want to keep it in a healthy range and as normal as possible, because you know it can still cause damage in things if it's high or low. Another type of test is called an oral glucose tolerance test. This is a screening test that's usually given to pregnant women to check for gestational diabetes. So I did just have a little note on here from the American Diabetes Association. So they recommend routine screening with diagnostic testings for type 2 diabetes in all adults age 35 and older in the following groups. So people younger than 35 who are overweight or obese and have one or more risk factors associated with diabetes. Women who have had gestational diabetes, people who have been diagnosed with prediabetes, because prediabetes can easily transition to type 2 diabetes. And children who are overweight or obese and who have a family history of type 2 diabetes and other risk factors. So what are some of the risk factors? So we've already talked about, you know, being overweight or obese. That's a main risk factor, but fat distribution. So storing your fat mainly in your abdomen rather than in your hips and thighs indicates a higher risk. So if you're a man and your waist circumference is 40 inches or higher, or for a woman with 35 inches or more for your waist, that's an indicator that you're at a higher risk. Doesn't mean it's guaranteed, but it just means that you're, you know, as you're checking off these risk factors, the more risk factors you have, the more chances you have of probably becoming a diabetic at some point. Inactivity, your family history, so your race and ethnicity. So they're not really completely sure why this is, but certain races and ethnicities do tend to have more diagnoses of diabetes. So that would be like your Black African American, Hispanic, your Native American populations, your Asians, and Pacific Islanders. They're more likely to develop type 2 diabetes than white or European descendant of the population. So if your blood lipid levels are high, blood lipid levels are cholesterol. So if your LDL and your HDL, which is your good cholesterol, they call LDL like your bad cholesterol. But basically, when you think about it, it's like, so if we're saying like, you know, okay, some of the risk factors could be, might be overweight, might not be eating the healthiest diet, we're not really as active as we should be, so chances are they go hand in hand. Your blood cholesterol usually starts going up too because of all those things. Again, something, just changing some of those activities and changing your food types can also help with that as well. So age. As we get older, especially after age 35, this risk continues going up. We talked about prediabetes, how that left untreated and no lifestyle changes could eventually cross over into type 2 diabetes. So pregnancy related. So again, if you developed gestational diabetes when you were pregnant, or if you had a baby who weighed more than 9 pounds, which is a larger baby, you tend to be more at risk. Some women have been diagnosed with polycystic ovarian syndrome. That too can be a risk factor. And then areas of darkened skin, usually armpits and the neck. The condition often indicates insulin resistance. So management and treatment. So like we said, sometimes you can treat diabetes with diet and exercise. So healthy eating, regular exercise, losing some weight if you need to lose some weight, possibly diabetes medications or insulins, and just monitoring your blood sugars. So some of the medications, I just wanted to go over briefly. You may or may not be taking them, or you may hear them be mentioned to you at some point if you're diagnosed. But metformin, that's usually a first-line medication. So when someone's first diagnosed with diabetes, this is a medication that they give by mouth. It's a pill. You might also hear of Fortimet, Glumetza, and others, but these usually work by lowering the glucose production in the liver, and they increase the sensitivity of your cells to insulin. Some side effects of this though, some people develop a B12 deficiency and may need to take supplements. Nausea, abdominal pain, bloating, and diarrhea. So a lot of GI symptoms with this. There's another group called sulfonylureas. These help your body secrete more insulin. So examples of this is glyburide, glipizide, also Amaryl. So you might have been on some of these. So these basically, side effects, they can lower your blood sugar too much. So again, you want to make sure you're eating properly. They can also make you gain weight, which I know sounds a little counterintuitive. On the one hand, we're saying, you need to lose weight to help, lower your blood sugar, but then we're going to give you a medication that's going to possibly make you gain weight. Another one is glutamides. These stimulate the pancreas to secrete more insulin. So these are a little bit faster acting than the previous group, but their effect is a little bit shorter, so it don't last as long. So these are a few here. So they might be like repignolide and nataglynide. So side effects of this is, again, low blood sugar and weight gain. So still very similar side effects. Then you have thiazolinides. So these make the body's tissues more sensitive to the insulin. So this helps that if your body is making some insulin, that your body's going to be more receptive to get it in there. And again, your doctor will choose what medication is best for you. You may be on, one or two, and then you might, switch them. So that's definitely something that you would have a conversation with your doctor. And you can ask him why he's preferring one over the other, and he would be happy to educate you. So this group is like Avandia, Actos. So the only thing with this one, it helps you be more sensitive to the insulin, but there's also the risk of congestive heart failure, some side effects too, a risk of bladder cancer, bone fractures, high cholesterol, and again, weight gain. Then you have some other ones. These ones you might see commercials for on TV, like a DPP-4 inhibitor. This reduces your blood sugar levels, so you might see Januvia or Tridenta on TV commercials. So some side effects of this is risk of pancreatitis, which is inflammation of your pancreas, which can be painful, and joint pain. Another type is GLP-1 receptor antagonist, which means nothing to the general public. You may have heard it called by other names, Ozempic. There's a big commercial for Ozempic on TV. Victoza has a couple of different brand names. So side effects of that can be pancreatitis, nausea, vomiting, and diarrhea. A lot of GI symptoms. Another type can be what's a type called SGLT2 inhibitors. So these affect the blood filtering functions of your kidneys. It inhibits the return of glucose to the bloodstream, so it keeps it from coming back in. So basically this glucose, blood sugar, is excreted in your urine. So these drugs reduce the risk of heart attack and stroke in some people with high risk. So these examples are Invokana, Phyrexia, and Jardiance. So you've seen Jardiance commercials on TV, I'm sure, too. So some side effects of this can be a risk of amputation. So it sounds like there might be some circulatory issues, risk of bone fractures. And these seem to be only with the one medication, that's the generic name, cangaflunasin, but its brand name is Invokana. So if you're taking any of these medications and you have concerns, please reach out to your doctor and discuss them with them, and they can help you maybe, understand maybe why you're on these medications, or, maybe if there's a different choice that you can come to together. So also the risk of gangrene, vaginal yeast infection, urinary tract infections, low blood pressure, high cholesterol. So other medications your doctor might prescribe in addition to diabetes medications include blood pressure medications, cholesterol lowering medication, and sometimes aspirin to help prevent heart disease. Because again, some of this is lifestyle related, so it can also have other conditions with it. They call that comorbidities, if you've ever heard it. It just means that you have more than one disease happening at the same time. You could possibly be put on insulin therapy. Some people who have type 2 diabetes can end up taking some insulin injections as well. So COVID, when you have diabetes and sick days. So if you have a sick day, if you have COVID, it can impact you more if you have diabetes than someone who doesn't have diabetes. So eating certain foods or too much food, being sick, not taking medications at the right time, these are things that can cause your blood sugar to start going up and be high. Higher risk factors, higher risk of complications with any virus. So anytime you get any kind of virus, whether it's COVID, the flu, anything that's with your sick days, it puts you at higher risk for complications because your body's already having trouble processing and functioning. So this just adds another level of stress to your body that it has to deal with. So viral infections can also cause inflammation. Viral infections, people with diabetes do face an increased risk of diabetic ketoacidosis. So if you do get sick with a virus, it can impact your sugars. It can also impact how your body's using that insulin, depending on where you're at. And it can also put you into this diabetic ketoacidosis. So it's something to be mindful of if you do get a cold or flu or, happen to get COVID. And that concludes my presentation. And I want to thank you for taking the time out to listen. If you have any questions, please feel free to reach out to your physicians. There's also a lot of actual people that specialize. They're called diabetes educators. Sometimes your insurance companies have them, home care companies have them, but you can also reach out to your doctor as well. They're great with talking about nutrition, a lot of diabetic education. You can talk to nutritionists if you're really not sure of what types of food you should eat, or if you need to make some of those lifestyle changes. There are groups that you can reach out with. The American Diabetes Association as well are another great advocate and support group for education for information. So thank you and have a great day.
Sherry, thank you so much for that presentation. That was wonderful, and I'm sure it's going to help our tribal community when they have questions about diabetes. Now, can you tell us a little bit about yourself?
Sure. So, like I said, my name is Sherry Munson Caputo. I am a member of the Nanticoke Lenape Tribal Nation. For the past about a year, a little over a year now, I've been working as the Tribal COVID Coordinator. I was also just recently elected to Tribal Council. I'm a nurse, registered nurse for Pennsylvania, New Jersey, and Delaware. I also have a Florida nursing license as well. I got my bachelor's degree in nursing at Widener University in Pennsylvania, and I got my master's degree at Wilmington University, which is in Delaware.
Excellent, Sherry. And what called you to the nursing field or to become a nurse?
I really like helping people, and I really, really enjoy the science. Your body is just so amazing. If you stop for a minute and think about your body, you're made up of trillions of cells. And each one of those cells is functioning independently yet together in order to make you, who you are, walk around, and just live your life every day. So just that science is very fascinating to me, but also being able to, take that down and help people really to live the best lives that they possibly can.
Excellent. Now, the Native Power Hour deals with Native issues and Native arts, and I know that you are working with the tribal community. Can you tell us a little bit about what some of the things that you're doing and what called you to work with the tribe?
Sure. So, like I said, with diabetes, it really does affect certain ethnicities more so than others, like we had talked about in the video. So the African American population, the Native American population, the Asians, Pacific Islanders, for some reason, they're not exactly sure why, those ethnicities seem to have a higher rate of diabetes than our white European counterparts. Being able to work with the tribe, I originally came in for COVID, really just to kind of help my tribal family to advocate, educate, and provide information so that they can make the best decisions that they can for themselves. Not to tell them what to do, but to give them the information that's available so that they are comfortable and confident in the decisions and choices that they make with their lives and their health.
For the community, for those in our community that are struggling with diabetes, what are some suggestions that you would have for them?
So really, one of the main things that you can do is really just try your best to live a healthy lifestyle and to eat healthy. Our elders, I tell a lot of our elders, eat like you did when you were growing up. When you grew up, everything was either fresh, you could identify all the ingredients and what you were eating. It wasn't processed, it wasn't packaged, it was real fruits and real vegetables and real meat that you ate. Try to eat small, frequent meals versus really large meals. Try to watch all those what we call simple sugars, cakes, cookies, pies, white flours, and switch to more complex carbohydrates, your whole wheats, your sweeteners from your fruits, things like that. And then just exercise. I know a lot of times people say, I don't feel good enough to exercise, I busy, things like that. Exercise doesn't have to be going to the gym and lifting weights and, a really big workout. It can literally just be 5 minutes. Take 5 minutes in the morning and just take a little walk around the neighborhood. It's good for you mentally and it's good for your body. Maybe do the same thing at lunchtime. Maybe do it again at dinner time. You'll sleep better, but that will literally give you 15 to 30 minutes of exercise a day without it being like the big blocked out time of 30 minutes. That's the best thing you can do to try to help control your weight, to help with blood pressure issues, help with your blood sugars. So that's really, really one of the most important things. Just keep staying active and just be mindful of what you're putting in your mouth.
Now, I do know that you have to test your blood to check once you're diagnosed with diabetes. Can you tell us a little bit about that?
Sure.
And the numbers?
Sure. So, like I said in my video, in order to get diagnosed with diabetes, and it's something they'll check, but usually when you go for your annual physical, you'll get a blood test called an A1C. This is a fasting blood test, and that's a test that looks for a 2 to 3 month period. And based on what those numbers are, you can be pre-diabetic like we discussed. You get a diabetic diagnosis if it's 2 or more test results that are elevated. So that's that blood test, and there was a whole, a few other blood tests in there. But a lot of people end up having to use a glucometer and do the finger stick. So sometimes if you're on oral medications like the metformins and things that we talked about, you might only test yourself once a day. In the morning, it's called a fasting blood sugar. That's looking at what your base rate levels of your blood sugar are before you eat anything. You're not going to test yourself. You're going to test yourself as much as your doctor has ordered, but you're usually not going to test yourself before each meal because you're not really going to do anything with those numbers. But if you're on insulin, you will probably test yourself first thing in the morning, before breakfast, before lunch, before dinner, and maybe even before bedtime. And that's because there's usually an action involved with that testing. So it's called a sliding scale. So you might have what's called a base units of insulin that you should take. Insulin you can definitely will take if you're a type 1 diabetic, but some people with type 2 diabetes will take insulin as well. And then based on what that test result is, you're going to add additional units based on what's called that sliding scale that your doctor has decided is best for you. So just to give you an example, if your blood sugar might be up to 120, you might not do anything but your base rate. But maybe when you get 120 to like 140, and again, these are just examples. These are not, again, your doctor will prescribe what you need to do. You might add an additional 1 or 2 units to what your base units are. So that's why people are doing that blood sugar test to really determine how much insulin they should take and when they should take it and before meals. Because as soon as you eat something, your blood sugar is going to go up because your body is breaking down all those carbohydrates into glucose like we talked about, because each one of your cells needs that glucose so that it can have energy to do its job function for the day.
Excellent, Sherry. Thank you so much for participating in the Native Power Hour and providing this wealth of knowledge on diabetes. And it will, I'm sure, help our community as well as others. And again, we want to say Wanishi for helping us with the diabetes and for giving us this information today. So, Wanishi.
Thank you for having me, Wanishi. And don't forget to reach out to the American Diabetes Association, talk to your physician, reach out to a diabetic educator or a nutritionist if you have any additional questions or need some additional help controlling your diabetes. Wanishi.
I hope that you enjoyed this episode of the Nanticoke Lenni Lenape Tribal Nations Native Power Hour, Diabetes Awareness and COVID-19 with our Tribal COVID Coordinator, Sherry Caputo. The Native Power Hour has been made possible by a grant from the National Endowment for the Humanities, Sustaining Humanities through the American Rescue Plan, in partnership with the Association of Tribal Archives, Libraries, and Museums. Make sure to like, share, and subscribe, and catch our next episode, Regalia for Different Dance Styles, with Corey. And again, my name is Linda Little Bright Star Jackson, and I will catch you next time on the Native Power Hour. Wanishi.